Welcome to today's webinar. I'm the What Works for Health Team Director with the County Health Rankings and Roadmaps program. I'm joined today by my colleague Justin Rivas, a community coach with the program.
Hi and welcome to today's webinar. In the next 20 minutes, we'll introduce you to What Works for Health, strategies to improve rural health.
The County Health Rankings and Roadmaps program is a collaboration between the UW Population Health Institute and the Robert Wood Johnson Foundation. Thanks to the Foundation's support, we're able to bring you this webinar today. So as most of you know, our program releases the County Health Rankings annually, ranking the health of almost every county in the country. The rankings serve as a call to action to improve health locally. We also released a key findings report calling attention to national trends. Our 2016 report focused on the differences in health between urban and rural areas. Our analysis showed what many of you already know. There are health disparities between rural and urban areas. Rural counties have the highest rates of premature death, lagging far behind other counties. And as you see here, it doesn't appear to be getting better. We see rural counties, in blue, have had the highest rates of premature death for many years, while more urban counties, in green, yellow, and red, are showing improvement. Premature death rates are rising in rural counties. And there's no one single factor that explains this disparity. Our analysis showed differences across the many factors that influence health. So the key findings report charged us as a program to ask ourselves, how can we do better to support healthy rural communities? One of the things we did is create What Works, Strategies to Improve Rural Health. This report shares some strategies from the Rankings and Roadmaps What Works for Health database that can make sense and make a difference in rural communities or low-density areas. It serves as a starting point to help you tackle questions like what's working to prepare and strengthen our local workforce or to reduce injuries, what's working to improve access to high-quality health care, and to improve diet and increase exercise. The report also includes strategies that can help to address many other questions facing rural communities across the country today. In the report, we include specific examples of strategies that could move the needle in rural areas. So here we have 3 examples of strategies that can address outcomes related to diet and exercise. First, school breakfast programs. These programs make breakfast available to kids in classrooms, in cafeterias, or in grab-and-go carts and hallways. School breakfast programs have been shown to improve nutrition and to improve academic outcomes. Activity programs for older adults is a second strategy. These programs bring older adults together for physical activity or for social engagement in an ongoing way. These programs have been shown to improve physical and mental health for participating adults. Last on the slide, you see healthy food initiatives in food banks. These programs make healthier foods available in food banks and in food pantries, often along with nutrition support such as cooking demonstrations or point-of-decision prompts. And healthy food initiatives in food banks can help to increase consumption of healthy foods and to increase food security. So in creating this report, we thought about strategies across the lifespan and across various socioeconomic circumstances. We also thought about the different levers and partnerships that can support change. For example, to increase access to high-quality health care, you could partner with schools to increase access to oral health care using school dental programs. You could harness technology to expand access to medical care through telemedicine, telehealth, telemental health initiatives. You could also work to support policy changes that increase the availability of medical professionals with financial incentives to serve in underserved areas, including rural areas.
Hi everyone, this is Justin. I had a few questions coming in saying I was difficult to hear, and since I'm not talking that shouldn't be a problem, but I think I cleared it up. But I did want to chime in and just mention that we do have some live chats that are going out in the chat function of GoToWebinar that are just kind of showing some of the things that Allison has been talking about. In addition, please feel free to use the questions section throughout the next couple of minutes as Allison continues her discussion so that we can maybe have some questions lined up near the end. So with that, I'll kick it right back to her.
Thank you. So for each strategy in the report, we provide a short program description. We also show an evidence of effectiveness rating from What Works for Health. These are the two letters you see on the screen in front of you, and they help to indicate how likely a strategy is to work based on best available evidence. And we'll get into those a little later in the next few minutes. We also provide suggestions of decision makers who could implement efforts locally. These are important stakeholders to have in your coalitions and partnerships as you move forward. So this report provides a starting point. It gives 60-some strategies with some information about each that can help you identify work that you can do to improve health locally. In our online database, we include more strategies and more content. We include strategies that can move the needle on health behaviors such as diet and exercise, alcohol and drug use, also to improve access to high-quality health care, and strategies that address those more upstream factors such as education, employment, and income that we know have a greater impact on health over time. We have about 370 strategies in What Works for Health today, and we regularly update our content and new strategies. So for each of the strategies in our online database, and by strategy I mean policy, program, systems, environmental change, we include an evidence rating. We include a short literature summary that highlights who a strategy can benefit, what it can do, and as we have it, information about cost. We also include disparity ratings to help communities use an equity lens as they explore strategies that could work locally. And last, we include implementation resources to help folks move from an idea of what they might do to actually putting that strategy in action. So here's an example of what that looks like in our online database. For those of you and me who like to read the details, I know this is a tough slide, so I'll ask you just to bear with me as I walk through. At the top left, you see a thermometer with an evidence rating. Again, this is the likelihood that a strategy will work based on best available evidence. This strategy is rated scientifically supported, so our highest rating. Below that, you see the health factors we're thinking about as we assign that rating, and below that, the decision makers who could implement the strategy. If you shift over to that paragraph on the right, that's a description of the intervention and gives you a sense of what school breakfast programs really are and our scope as we assessed this intervention. Below that, you see the outcomes that we consider when assigning the rating, so you can really read this as school breakfast programs are scientifically supported for effects on cognitive function, academic achievement, and healthy food consumption. We also highlight other potential benefits that have kind of popped up in our literature review under other potential beneficial outcomes. In the bottom left, you see the picture of the young girl. This is what we call a community in action. It's a short story about one community's work implementing that intervention and gives their contact information, so a step to help you move towards implementation. So if we pretend we're scrolling down the screen, this is the second half of that entry. You see the evidence of effectiveness section at the top. This is where we summarize the literature we reviewed with attention to who a strategy benefits, the outcomes it achieves, and when possible, information related to cost and what makes a strategy work well. You also see the impact on disparities. This is based on what we know from the literature about how a strategy is designed and how a strategy is typically implemented. And then at the bottom of the slide, you see some examples and resources. This is where we'll summarize some communities who've put a strategy in place, provide tools and resources to help move towards action. The blue text and the numbers you see throughout the screen are links to the underlying resources we consider when compiling this summary. So before we wrap up, I'd like to dive a little more deeply into that evidence rating I mentioned on the last slide. This is really core to what we do and a big piece of helping you use this information to select strategies. So our team of analysts seeks out, assesses, and summarizes best available research for each of the interventions in the database. We do this to give you a sense of what has been shown to work, what might work, and what does not work. So you'll see that continuum in the box on the right. Scientifically supported at the top is assigned to the strategies with the strongest evidence. These have been shown consistently to work in strong studies. Below that you see some evidence. These strategies are also likely to work, but we need to know a little more to say this so conclusively. Expert opinion and insufficient evidence in the middle are assigned to strategies where we have more to learn. These are often the newest ideas or strategies that have been implemented for a long time but perhaps not studied in a robust way. So these might work. And then at the bottom you see evidence of ineffectiveness. This is assigned to strategies that have been shown consistently not to work or to cause harm, so a place where you'd want to steer clear. When you're thinking about these ratings, I encourage you to come back to those specific outcomes, the expected beneficial outcomes that we saw on the school breakfast slide. So we've introduced you to two connected resources today. First, What Works? Strategies to Improve Rural Health. This is a report available in hard copy. Also, our online What Works for Health database. The Rural Report can serve as really a great starting point to identify strategies that could make sense in your community. I'd also encourage you to look to the online database to get some more information about those strategies or to get other ideas of strategies that could address your local priorities. So in just a minute here, we'll move towards some questions. As we do, I'd encourage you to consider these reflection questions. So first, who else might you share this information with? And second, what might you do to put these resources in action to help with your efforts? So with that, we'll turn to some questions.
Great. Well, thank you, Allison. And I welcome everyone. Please just start entering some questions if you have any that have popped up throughout the presentation or beforehand. I know a lot of you submitted questions as well. You can put that into the questions section on the GoToWebinar interface. So we'll just hold on here to see if a few questions start rolling in. And here we go. Okay. So I'll pose this to Allison. So how did you decide which strategy to put into the report?
It's a great question. We started by looking at the broader What Works for Health database, and we identified those strategies that we know have been tested or implemented in rural areas. We then also considered strategy portability, so to speak. How much does it matter for the effectiveness and the appropriateness of a strategy if it's implemented in an urban or a rural area? So we thought about particularly whether the problem the strategy seeks to solve is common in a rural setting, whether dense populations are necessary to implement that strategy well, and then whether application on a smaller scale can yield substantial benefits. So those were a number of the things that we thought about as we formed this report.
Great. Thanks, Allison. Thank you, everyone, for continued flow of questions. This is great. I got more rolling in as we speak. So I'll fire another one off here. There's actually been a few iterations or kind of questions touching on the same issue of costs, or what are some low or no cost options, or just some options maybe in areas that are lacking maybe in resources. So I'll pass that off to Allison.
This is really an important question and a tricky question. I know across the boards we're all facing a smaller pot, so to speak. Some of the things that I would suggest thinking about and that we see other communities think about are the types of resources that you feel you have, that you are rich in, so to speak. So do you have a committed core of volunteers? Do you have a motivated champion? Do you have a shared understanding of a problem? And based on those resources, how can you leverage the energy and the commitment that you have even if you don't have a lot of financial resources? Another thing that we've seen folks do successfully is to explore partnerships that are mutually beneficial. So sitting here in a university environment, sometimes what we see is communities partnering with graduate programs or undergraduate programs to assist with data analysis or planning or evaluation.
Great, Allison. Thanks. It is a tricky question indeed. So we have some other questions coming in, and I have a live one here that I don't think you touched on in great detail in the presentation, but basically, is there a way to search specifically for rural strategies on the online database, or what's the best way to directly do that?
It's a good question. There are a couple ways to do that. One way to do that is to use the keyword search and type in rural. As you do that, what I would remind you or maybe caution you is that the keyword search is searching for that word rural somewhere in the entry. So you're going to find perhaps more strategies than you need, and many of them will be relevant. Some of them may not be. So it's the beginning of your filtering, and then you'll want to comb through to see what strategies are most relevant to you. I would also encourage you to really start from the rural report itself, hoping that the work that we put in on the front end can really save you some time going forward. But again, to kind of cross-check those references to help give you what's going to best meet your needs.
Great, thanks again. I have just one more that's kind of piggybacking on that and I know, again, this information is in much more detail in the actual hard copy of the rural report, but maybe if you could speak specifically just a bit about how we're defining rural.
Another really good question. So I think this is almost a two-part question. In the beginning of the slide deck here where I talked a little bit, where you saw the trend graph talking about premature death, that actually came from the key findings report where there was some, our team categorized counties into large urban metro, large suburban metro, smaller metro, and rural. And they did this by adapting a classification system from the National Center for Health Statistics based on metropolitan statistical area designations. So there was a classification in supporting that trend graph. In the rural report, where we were selecting strategies that could be good starting points for low density or rural areas, we didn't use a specific classification system. Instead, we thought about a definition of rural that really focused on sparsely populated areas outside major urban or metropolitan areas. So one of those definitions is more quantitative, the other more qualitative. So looking through the questions here, we have one question that focuses on how best to gain community buy-in and engagement in rural areas. And Justin, I know you've worked with a number of communities, and the other coaches on our team have worked with communities. I'm wondering if you could talk a little bit about lessons learned.
Great, Allison. Thanks. Again, another really good question. And I think there's a couple ways to answer this, obviously given the context of each community and understanding that they're different. But from the onset of, if you're looking at a program, starting up a program or a policy change, really trying to get buy-in at the onset, at the beginning of the process, building some strong energy around that. And building that energy also on some existing strengths or assets you already know you have in your community, or you know that there's already community buy-in around. And then another way to frame this too is to think about basically whether looking in programs and policies, which place is the best place to maybe shift your resources. So given maybe that you have some political will, policy change might be the better option and easier place to gain maybe community buy-in if there's community support for it, then and a more cost-effective or maybe, for lack of a better term, cheaper route to go would be policy change, given the support is right in your community. And I know if you have more questions about this, we do discuss kind of that balance of fidelity and fit. We could answer those questions offline as well too. So that's how I go about answering that one. I'm going to keep filtering through because we have a lot of good questions coming in, but we're really close on time. So by close on time, I mean we're pretty much out of time. So basically what I just said, there's a feature that you can contact us at various places on our website, and you can either just send in questions if you have direct questions. We have kind of a rapid response format where we try to get back to respond to any questions within a 24-hour cycle or so. And that's a good way to kind of get more directed answers to your wonderful questions. So I just want to take this last minute to just thank everyone for participating and jumping on this webinar short, as it was short indeed. So thank you very much, and we hope to see you on future webinars with County Health Rankings. Again, all of our materials, handouts, we'll be passing on after the fact. So thanks again, and we'll see you all soon.